Good afternoon. Thanks to all of you for being here today and everyone for tuning in across the state of Mississippi. We obviously had gorgeous weather in our state this weekend, and I hope many of you had the opportunity to get out and enjoy some fresh air and doing so in a responsible way while social distancing, because what we know is that we are still in this fight. The last time I was before you, we had come off a day in which we had, for the first time and now only time ever, over 400 new cases reported on Friday morning. Over each of the last 3 days, those numbers have come down considerably relative to that peak on Thursday. But again, just because the numbers are not as high on a particular day, we're not going to celebrate. Just like when the numbers are high on a particular day, we're not going to panic. We're going to look at long-term trends. We're going to average both on a 3-day basis, a 5-day, a 7-day rolling basis, so that we have a good understanding, because we realize and we know that different things affect daily number of new testing results, including data dumps from testing sites, data dumps from out-of-state testing sites, as well as other factors that come into play. So the end result is today, on Monday, in spite of the number of cases that came in over the weekend, the fact of the matter is we are still in the middle of this fight. We still have significant challenges before us, and we as Mississippians have the responsibility to stand up, to do right, to take care of yourself, to stay strong in the face of unprecedented action, and recognize that we believe we can both protect the public health of all Mississippians while at the same time recognizing that we have real challenges from an economic standpoint in this state and in this country. When we allow businesses to reopen, it is not because the risk is completely gone. If anything, it means that you need to take things even more seriously. You need to make decisions that are in the best interest of yourself, of your family, and of your fellow Mississippians. You need to take extra steps to keep your friends safe and extra steps to take to keep your neighbors safe. Now, while we recognize that we cannot ask small businesses and their workers to sacrifice their life's work, I continue to ask all of you to take this deathly virus seriously. Today, I signed an executive order related to Mississippi's unemployment system. Most of it is very technical, but it also affirms that Mississippi is going to have to continue to evaluate and interpret able to work in the face of this new threat. What does that mean? What it means is that you must understand that if you are currently unemployed due to COVID-19, and if your employer calls you back to work, I strongly recommend that you go back to work. I do so for a number of reasons. It is true that under state law, that if you were to choose not to go back to work, you could become ineligible for those state benefits. But also, understand that the $600 a week in pandemic unemployment assistance goes away. It goes away in July. So you may say, well, that's okay, I'll figure it out in July. The fact is that this immediate economic disaster that is unfolding right now is real. If businesses try to reopen and cannot find the workforce to reopen, it is very possible, if not likely, that that business is not going to make it. It is very possible, if not likely, that when you decide in June or July or August to go back to work, that job that you are accustomed to will not be there. Remember, when those pandemic unemployment assistance benefits go away, the maximum state benefit on unemployment is $230 a week. Many on unemployment assistance make much less than $230 a week. Therefore, I implore every Mississippian that as these small businesses reopen, take advantage of the opportunity to go back to work. I also want to raise the flag to warn everyone about what I fear could be a second wave of our economic crisis. As we think about where we find ourselves today, understand that many businesses in our state continue to work. Manufacturing, construction, never closed in Mississippi. They stayed open in a responsible, reasonable way. They did good things, and that's something that I'm proud of them for. But also understand that as global demand, as we move into the summer and fall, may be reduced, the opportunity for businesses in Mississippi who produce product and ship it to other states and ship it to other countries may also see their demand be reduced. And so we have to be sure that as we move into the reopening of those phases of our economy that have been closed, that we do everything in our power to make sure that they can return with the workforce that they need so that they can produce not only for them and their families, but also for the workers and their families. We are going to do, in this process, everything we can to accommodate those people who are most at risk. But we cannot allow the historically high unemployment benefits that may come crashing down at some point to put you in a position where you cannot provide for your family, not just for the next couple of weeks or months, but for the next several years and years. There is really no government replacement for a job. I know most Mississippians are ready and eager to get back to work. Please do not let the window pass you by. If you are lucky enough to get an offer to come back to your job or to earn a living, please do not reject it. I do not want you to wake up in August with no job to return to. I know that I've heard from so many of you over the last several weeks, just itching to get back to work. For those of you who are able to do so today, because of the decisions that have been made, I'm proud of you. I know it was tough. I know it was tough for weeks on end. But as we move forward, we will continue to focus on the public health crisis before us and understand that we're also dealing with an economic crisis as well. With that, I'm going to turn it over to Dr. Dobbs and let him talk about our current caseload. Dr. Dobbs?
Thank you, Governor. For today, we're reporting 173 new cases and 5 new deaths. Unfortunately, the new deaths occurred in Adams, Itawamba, Lauderdale, Leake, and Neshoba counties. As discussed earlier, there is significant day-to-day variability in the case count. Although we welcome a low number or a lower number, we don't anticipate that there might not be some variability. Our total number of cases reported to date are 9,674 with 435 deaths. We have seen a gradual decrease in our overall hospitalization rate, which is consistent with expanding testing to people who are less severe state of illness, 17.9% hospitalization rate. We have an estimated number of recovered patients at 6,268. I'd like to talk just for a second about testing and access to testing. Thus far, Mississippi has reported 95,885 tests. We have identified several out-of-state labs that are not reporting their negative results, so hopefully we'll see that value increase rather rapidly as we get a better accounting of those specific labs that have been operating in Mississippi. We have been getting all the positives, but we haven't been getting all the negatives. Just want to reiterate that. As far as testing, I do want people to know that we are continuing to do the UMC Department of Health partnership with drive-through testing. Of course, it goes through every day at the Jackson Fairgrounds every day. And then today it's in Winona and also in Conahata. Is that how you say it? No, it says Conahata. That must be the city, not the town. Also in tomorrow will be at Laurel Fairgrounds, May 12th, and Louisville tomorrow. So if you think that you might have been exposed to coronavirus, or if you think that you have symptoms of coronavirus, even if it's a cough, a sore throat, a fever, chills, please feel free to call and go to one of these testing locations and go to the UMC website to get the information for getting an appointment. There's the C Spire Health app to get screened for an appointment, but also there's a number you can call if you don't have a smartphone, and it's 601-496-7200. Also, we have on our website the different locations where people can get tested in their community. And also would like to reiterate that the community health centers are offering testing around the state. I had a nice visit with Dr. Rashad Ali in Laurel today and excited about the work they're doing. They're testing not only in their clinic, but they have a mobile clinic that's going to the community so that people can access it right where they live. So please, if you need to get tested, get tested.
Thank you, Dr. Dobbs. We are fastly approaching 35,000 per 1 million residents in terms of testing. That continues to make Mississippi a leader. And as we get more and more of the accurate data in from out-of-state testing labs, particularly on their negative testing results, that may even pop up even more. But as we move into this next phase, what I want to tell you is that I've heard several of my colleagues say, when in doubt, get tested. And so we're not suggesting that if you have absolutely no symptoms that you should run out and get tested. But if you do have symptoms and you're wondering if perhaps you have the virus, it makes sense to at least reach out to your physician or reach out through UMC's website to get tested, because as we move into the next phase, as we are reopening, the way in which to ensure that we don't have community spread in areas is to identify cases early, and the best way for us to identify cases early is for you to be tested. And if you test positive, then we can deal from a contact tracing standpoint with the issue and ensure that it does not spread in the community. With that, I'm going to turn it over to Director Michelle to talk about the Emergency Management Agency's efforts.
Thank you, Governor. Governor, the partnership between the Mississippi Department of Health and Mississippi Emergency Management Agency continues to be strong during the COVID response. PPE and logistical operations continue. Matter of fact, worked through the weekend. We delivered to 4 counties and 6 facilities within those counties just yesterday. So the PPE will continue to purchase that and push that out as appropriate where it needs to be. Federal declaration update. We received word from FEMA on Friday late afternoon that the 6 additional counties have been added to the individual assistance declaration. That is for the Easter tornado on the 12th of April. Those 6 counties that were added for individual assistance were Clark, Grenada, Jasper, Lawrence, Panola, and Walthall County. Those counties will also have disaster assistance centers that will be opening tomorrow starting at noon. Those locations in Clark County will be at the Clark County Emergency Management Office. In Grenada County will be at the Lewis Johnson Senior Citizen Complex, and Jasper County will be at the Jasper County Emergency Operations Center. Lawrence County also at the Lawrence County Emergency Operations Center. Panola County will be at the Panola County Extension Building in Batesville, and in Walthall County, the Walthall County Emergency Operations Center. These facilities again will open up tomorrow starting at noon till 5 o'clock. Their operations will be Monday through Friday thereafter from 8 to 5 and Saturdays from 8 to 12, and they will be closed on Sundays. If you have any information or need any additional information about this, you can look at our website at www.msema.org, or you can call at 1-866-920-6362 for additional information. With regard to the 25 counties that we've requested to add to the public assistance declaration for that same storm, we're still waiting to hear back, and we hope to get some word back this week on those 25 counties that were added. On the 22-23 April storm, we've got 10 counties that did in fact meet their public assistance damage thresholds, and in turn the state did exceed their damage thresholds, so we'll be requesting joint damage assessments with FEMA for those 10 counties. Those 10 counties are Amite, Claiborne, Covington, George, Jefferson Davis, Lawrence, Pike, Simpson, and Smith County. Once those joint damage assessments are complete and validated, then we'll be requesting to FEMA for a Federal Declaration of Assistance, PA, for those additional counties. And then finally, as we all know, We just wrapped up Hurricane Preparedness Week this past week on Saturday. Just a reminder, that does not mean that hurricane preparedness and planning ends there. We did have a very productive call on Saturday with all of the 82 counties to include those lower 6 coastal counties. Very productive. Great start to our own preparation and planning to ensure that we're ready going into the hurricane season, which officially begins on June the 1st. Governor, that concludes my update, sir.
Thank you, Director Michelle. I just want to ask my fellow Mississippians to continue to pray for our public health team, our emergency management team, all leaders in our state. Obviously, we are not only dealing with COVID-19, but also the multiple tornadoes that ripped through our state in the month of April, the fact that we are moving very rapidly into hurricane season, and we do anticipate that we could have a very active hurricane season in the Gulf of Mexico this year. The water seems to be warmer than typically, than what is typical, and therefore that could lend itself to more hurricanes in the Gulf. So let's all work together to prepare for not only the crises that are before us, but also those that are on the way. And with that, I'll open the floor to questions. Courtney Ann.
What is the status on potential restrictions or additional restrictions for those hotspot counties? I know that you guys have talked about that some. Is that coming soon? Should those counties anticipate that maybe even a salon or gym that has reopened today, or one of those businesses, could have to pull back on that?
Yeah, I would anticipate that you will hear something very, very soon. Our team with the Department of Health has been looking at exactly how we want to approach that, and it's really more in the specifics as to exactly what's going to happen. We have a good idea of the counties that are going to be affected. It's been those counties that we've talked about repeatedly. I don't think you'll see there be an attempt to roll back the reopenings. I think you'll see more stringent requirements in terms of mask, for instance, and things such as that. We've had great conversations throughout the entire weekend, as well as that bled over into this morning. So I think you'll see that coming very, very soon. Dr. Dobson.
Yes, and thank you for your support and leadership in all of this. Been working closely trying to find language, and also have been speaking with community leaders across the region, trying to get a sense of what they think is most important and what can be implemented successfully without totally hobbling their steps forward. So I think we'll have some good information and some good guidance very, very soon.
Yeah, Courtney, and ultimately, I'm going to have to sign the order. I am prepared to do so in working with Dr. Dobbs. But our approach for the last 9 to 10 weeks has been, anytime we're doing something that affects local governments and local leaders, we've tried to reach out to them. We've tried to get their input, and this is no different. It's very important that the folks who are leaders at the local area have the ability to not only have input on the front end, but also understanding as we go forward, so that they can help educate their citizens. That's critically important. Obviously, I can sit here and we'll do it and tell everyone here's what the order reads. But in terms of enforcement, most of that is left to local law enforcement, and so the local leaders have to have buy-in. And this is something that I think, by and large, we're going to have significant buy-in in the local communities, because they see what's happening and they see the number of cases. I forget the exact numbers, but over the last 14 days, somewhere in the neighborhood of 1/2 to 2/3 of all new cases in Mississippi were confined to a very small number of counties, some of which were larger in population, which you would expect. And then you've got a small number of counties that are smaller that are adding significant number of new cases, and that's really where we're going to focus.
Ashley Merwood with MPB has a question. Ashley?
Hi, good afternoon. This is a quick question for you. It's kind of a two-part question, but in terms of testing and contact tracing, and I know we spoke a little bit about it earlier, but my first question is, sort of explain what that process looks like. I guess it'll be more so on the contact tracing side of it. But in addition to that, overall, just where are we in our state in terms of testing and contact tracing, the capability of it, and especially in our hotspot counties, like we mentioned, Lauderdale County, and those minority communities where we know the infection rate and death rate is continuing to be disproportionately higher.
Yes, thank you. Great questions. So much to talk about, actually. So, we've invested a lot of time and resources and attention in the areas that are very active, especially within the Black community, understanding the specific challenges and the excessive risk that they're seeing. As far as testing, obviously we've tested a lot of people, and a lot of that has been focused in areas with a lot of activity, and obviously we're finding cases too. So we also have made sure that we're working very closely with community health centers, which have a unique capacity to make sure they can reach hard to reach communities, but also anyone can get tested there. So it's really a community resource for everyone. Some of the testing, like the ID Now machines that we have, we made sure we focused them on areas where they do have a large proportion of African American cases. So it's a whole collection of things trying to do to make sure we have testing, but I can't speak enough about the community clinics and the partners there that have done the bulk of testing. It's the local docs, it's the clinics, it's the nurse practitioners, all out there taking care of folks, making sure we get this testing done. So it's basically all hands on deck sort of scenario, and we want to keep pushing that. And the health department's going to be doing more and more outbreak testing, more and more testing in long-term care centers. Expect to see a whole lot more of that as we go forward. In the contact tracing, just really quickly how that works. The testing identifies a case, and we do a couple things. We determine if it's an outbreak-related case, and if it's an outbreak, which means a whole several cases within a common sort of exposure, then we have a whole different process as far as like doing a separate investigation. But if it's an individual that seems to be community transmission that's not traceable to a larger context, the simple approach is we contact that individual, we counsel them, we do an assessment, we collect information, and we put them on an isolation order. Isolation order lasts for 14 days. It's a legally binding order to keep them from going in the community and exposing others, also provide them education. And then we find out who around them would be considered at-risk contacts. And we contact all of those individuals also and put them on what we call quarantine orders while we're waiting to see if they get ill. And people on quarantine orders, again, will be 14 days on quarantine orders. We also have a mechanism where if people are, if we're notified that they're not following the orders, we have a set of people who help reinforce the need for it. There haven't been any legal actions taken so far. And we also have daily reminders that are sent out to all the isolated contacts and the quarantine individuals to make sure that they're complying. Anyway, so that's a long answer. Sorry about that.
The one thing I would add, and Dr. Dobbs and his team have done a fantastic job. As you know, in long-term care facilities, we define an outbreak as one case. And we made the decision weeks ago that we were going to test everyone in a long-term care facility that had an outbreak. In other words, if there was one person who tested positive, we made the decision that we were going to push resources and ensure that we tested everyone in the facility. Now, in our conversations with the White House, with Vice President Pence, with Dr. Birx, with our fellow governors earlier today, we had a great conversation around long-term care facilities. If you look at the total number of deaths out of long-term care facilities as a percentage of total deaths over the last 7 or 8 weeks of this, I think Dr. Dobbs said earlier it's 43%. I think that's the right number. But if you look over the last couple of weeks, that number is actually inched higher than that. And so we are going to work towards, with the new capacity that we have from a testing standpoint, to reach out and go attempt to test in every long-term care facility in our state, whether they have an outbreak or not. Now, that's an ambitious goal. We're not going to be able to do it tomorrow, but that is going to be our change in posture, or really just an additional focus on those facilities as we work to slow the spread of this virus in those most high-risk areas.
Emily with AP has a question. Emily?
Hi, Governor. I think you actually just preempted a lot of my question because I do want to ask about that White House recommendation of testing in all nursing homes, long-term care facilities in the next 2 weeks. What is the capacity in Mississippi? Like, do you have a timeline for trying to reach that goal?
Emily, we don't have a timeline on exactly when we believe we can reach that goal. We have started the conversation, and I think what you'll see is us develop a plan to accomplish that in the shortest time period possible. One of the things that we have been seeing is many of our efforts, whether it's the mobile testing units, et cetera, there have been days when it's been hard for us to find people who wanted or needed to get tested. There have been days where we have moved our mobile labs around and we haven't done a lot of tests. And so we're looking from a resource standpoint, how do we reallocate resources to support the Department of Health and their already very robust efforts. Again, what we're looking at is a scenario in which we're pushing towards 35,000 tests per 1 million population. That's 1.5 times to 2 times many states around the country. But now we're going to continue to push resources and testing, not only into those communities where we've seen significant number of cases over the last 2 weeks, but also in those long-term care facilities. Obviously, their goal initially a couple of weeks ago, the goal was to be able to test at least 2% of your population per month, 2% in the month of May. We feel very confident that we will be able to surpass that particular goal. Now the goal to test every long-term care facility, both, by the way, not only the individuals that are in the long-term care facilities, but also the employees. It's an ambitious goal, but it's one that we're going to work towards, and I'll give you a better time frame after Dr. Dobbs and his team and our team sit down and really map that out.
Dave Elliott with WLX has a question. Dave?
Thanks so much, Renee. Governor, you and the legislature are busy at work trying to get the CARES Act money out to people as quickly and efficiently as possible. The Senate appears to like the grants through the Mississippi Development Authority. Members of the House have told me they're looking at the Mississippi Department of Revenue or Tax Commission playing a role. Do you have a preference or any ideas of your own you can share with us today?
Well, thanks, Dave. I appreciate your question. We are having many conversations with legislative leadership, including one that just ended within the last 30 to 45 minutes. I think what you'll find is that we will come to an agreement as to what the best course of action is. The most important thing that we can do is get these money to people quickly, to get it to them as quickly as possible, to allow for them to do the things that they need to do to help themselves and help people across the state. And I'm hopeful that we can get agreement on that as soon as humanly possible.
Stacy Jacobson with WREG has a question. Stacy?
Yeah, hi. Thanks for taking my question. I wanted to know if the governor could clarify if there's a statewide policy for whether tattoo parlors are allowed to be open today.
It is my understanding that the order that we signed on Friday does not allow for tattoo parlors to reopen. That is the remaining small businesses that are not currently open. We are currently looking at those very closely and trying to determine when is the best way in which to get them open. It is certainly clear to me that in many of the same precautions that, say, barbershops and salon owners are currently taking, that those same small businesses can take similar precautions and open in a safe way. And so we're looking to clarify that here today or tomorrow.
Along those same lines, we've been getting messages, particularly from places like bowling alleys, asking about, if we had a reduced capacity in the same way that some of these other businesses are. Could you speak to if there are specific concerns or if it really is just kind of industry by industry trying to go down that list of how that reopening would look.
Yeah, we're looking at those more entertainment type businesses. We know that every single business is essential to those small business owners, and every single business is essential to those employees who depend on them to make a living. As we ease back into the reopening of the businesses that we had closed, we are looking into the best, most safe ways that we can put guidelines in place where they can reopen, but do so in a safe, responsible way. Renee?
Jack from Clarion Ledger has a question. Jack?
Yeah, I've got a question for Dr. Dobbs. At the beginning of April, we submitted a records request for a list of all the nursing homes with the coronavirus outbreak. And in May, we finally got a letter that you were CC'd on, and the letter offered no legal justification for not responding to a records request, but it simply said the Department of Health was too busy to respond to it. Are you saying that the Department of Health doesn't have a list of nursing homes with outbreaks readily available? And if you do, then why hasn't your department sent it to us?
Of course, we have a list of the nursing homes, and I believe that letter was really more about the legal wrangling back and forth of why we're not releasing them. We still, we've had outbreaks in long-term care for years, and to protect the identities and the privacy of the residents, and also too to prevent stigmatization of different facilities, it's always been our stance not to release long-term care stuff. So I think that other issue is really more about the legal process. But certainly we will try to make sure that we get to it as quickly as possible as far as addressing that piece of it. But we still have strong concerns that it's the wrong thing to do to release the name of the nursing homes.
Co-Brad with the appeal has a question.
Hey, so I'm just wondering if it's possible to get an updated testing numbers from the Department of Corrections, both employees and those imprisoned. And I'm also curious to hear from both the governor and Dr. Dobbs about asymptomatic testing within the Department of Corrections. Right now, per its own guidelines, they're only testing those with a fever of 100.4 or higher and those showing respiratory systems. So I'm curious about what's being done about a potential asymptomatic spread, especially in light of the comments today about, long-term care facilities, if testing everyone in prisons is being considered or not. I'd like to know that as well. Thanks.
You want to talk about asymptomatic testing? And
there has been some asymptomatic testing, to my understanding, around contacts, right? So that's going to be a high-risk sort of asymptomatic people who are being tested, and that's certainly a very valuable way to find new cases and to cut off additional spread. I don't have the numbers of the Department of Corrections available to me right now. Okay, yes, sir.
The total number of cases at the Mississippi Department of Corrections, and what I'm going to do is I'm going to give you the update as of 9 a.m. this morning, and then I'm going to give you a further update that I got before walking into this meeting. And again, these numbers change pretty regularly, so this is as of the most recent data that I have. Inmates 42 have been tested, of which 7 have been found to be positive. Staff 43 tested, of which there have been 7 positive tests, 34 negative tests, and 2 pending amongst staff. The update to that update is that sometime in the middle of today, we had 2 more confirmed cases sent over, so that there are now 9 confirmed cases within the department. I do want to reiterate that the total number of positives in our prison system is significantly less at this time than many other states. There is a process to determine who gets tested. The process is the fact that if you have symptoms, you go to the infirmary at the individual facility. They tend to test you for flu, they test you for strep throat, If you are negative of both, they then test you for COVID-19. Remember that we are providing PPE. We are providing PPE from the Mississippi Emergency Management Agency for our employees at the Mississippi Department of Corrections. They are handing out masks for all staff as well as all inmates. We made a decision very, very early in the process to quit and not allow for inmate movements. And this was literally, I think, 6 or 8 weeks ago. We stopped all movements of inmates, and we also stopped all visitation by visitors to the facilities. And so far, we have been fortunate with the numbers that we have in the prison system, but we know this is an area in which, just based upon what's happened in so many other states, where we have to continue to be very diligent. We have to work very hard to continue to make sure that our staff and our inmates are protected to the extent possible from this awful, awful virus.
Dave from WLOX has another question. Dave?
Governor, schools here on the coast and all around the state are making graduation plans under extraordinary circumstances, of course. Talk of distance learning continues, possible summer classes of some kind. But if the numbers spike, if this second wave hits, what kind of contingency plans are in place regarding what to do at the start of school in August for the next school year is being threatened?
Well, we are confident that our schools will start either on time in August, or some may choose to start earlier based upon the opportunity to get our kids back in a environment where they can learn, where they can catch up from anything that they may have fallen behind on during the spring. We are not anticipating a spike in cases that would lead us to not be able to do that. We're working very hard to fight against that, to guard against that, to be careful. We're reopening on a slow, smart basis so as to ensure that doesn't happen. But again, as you have heard me say repeatedly, the one thing that we have learned about the coronavirus is you should always expect the unexpected, because every single day has brought a new challenge that, fortunately, we've got great men and women in this state that have been leading this charge, that have stepped up to meet every single challenge. And I have no doubt, I am confident that should we get additional challenges, either through more cases in certain areas of the state or some other challenge, these men and women who are leading this effort from the Department of Health, the Emergency Management Agency, et cetera, our National Guard, we will step up and we will deal with whatever challenges we face.
Stacy with WREG has another question. Stacy?
Hey there, yeah, thank you again for taking my question, Governor. Going back to the tattoo parlors, if there are municipalities that are saying that tattoo parlors are allowed to be open there, are they in direct defiance of your order, or are they allowed to have that type of say for their own state?
Well, Stacy, we're trying to provide clarification on that topic here very soon. As you can imagine, when you're looking at the various entities that exist out there, there are specific measures that must be taken. There are specific things that must be taken into consideration. And this is a topic that, as soon as we get done with this press conference, we'll sit down and discuss and provide guidance to folks across the state. Gerald.
Should business owners be held liable if a patron comes in and get coronavirus? Should they be held liable?
No. I believe that the Mississippi legislature should strongly consider providing protection from liability for small business owners. I think that we should look into the potential of providing liability protection for a large number of different entities. As you may recall, when we were anticipating that we may see a huge spike in cases I actually issued an executive order which gave liability protection for our healthcare workers and for our doctors, many of whom we thought may have to jump in the fight in a specialty that they were not that they were capable of doing, but were not necessarily insured for. Fortunately, we never saw a major spike that led to that, but I think we should provide some liability protection. Individuals who are currently, remember, individuals who are in the most vulnerable categories, those that are over the age of 65 and those who have compromised immune systems and those who have pre-existing conditions, technically are still under a shelter-in-place order in our state. And that is because we know that this virus is particularly cruel to those over the age of 65 that get it, and it is particularly cruel to those individuals that experience some sort of underlying health condition.
Anita Lee with Sun Herald has a question.
Great.
Anita?
Hello, thank you. I have a couple of questions for Dr. Dobbs. On the daily testing, we're seeing a number of total tests with a rise in tests most days, but again, we've discussed the numbers vary widely on those new numbers reported. Are all the new tests reported also included in all the results you've reported to date? And with the numbers varying like that, how do you keep track of the pandemic and how it's growing or maintaining? And also, how many contact tracers do you have now?
And I think you're talking about the total test number. Is that correct?
Right, and the variations from day to day that add to the total, and whether
Right.
all those are in the
We don't
positive and negative.
we don't update those every day. It's a lot more challenging to get those in, especially with all these new labs coming in. You can imagine if someone calls you with a phone call with 3 positives, it's very easy. But when you have 1,000 negatives, if they're not in electronic format, most of like the lab, LabCorp, Quest, Mayo, they do electronic submissions. But the other labs that are operating, we have to collate them or they send them in different batches, and that's part of the issue. So we're working to try to make that more automated, but obviously it's a process since we have a lot of new players out there. But it is a very important metric as far as like the percent positive, and so that's one of the reasons why we're really trying to make sure we get them all as quickly as possible. We are working with these partners to get them electronically submitted or in a manner that we can upload into our tracking system. Obviously, you can't hand count 95,000 tests. So we are working on it. We do know it's lumpy. We understand that's kind of hard to slice and dice, but we are working on it. And then for contact tracers, we have some shifts because we work through the weekends, obviously, trying to do that. And we're currently running at about 200. I don't have the exact number.
I would just simply add that when you look at total number of tests and you look at number of positive cases reported on a day-to-day basis, that is a data point, and it is worth considering. But in terms of where we find ourselves overall, it is also important that you look at, and this is something that Dr. Dobbs and I both look at very closely, and that is the chart which has COVID-19 based upon date of illness onset. That is a much better chart to look at than just the individual total number of positive tests from one day to the next, because of that very large variability in when those testing results come in, depending on the type of lab that is out there.
Dave from WLOX has another question. Dave?
Yeah, this for the governor and or Dr. Dobbs. On April 16th, President Trump recommended that there would need to be a 14-day decline in the number of cases before reopening would be phased in. The White House nor the CDC have never officially relaxed that standard. So what data are you using to determine reopening measures?
Thank you, Dave, for for that question, and it's one that I've been asked many times over the last several weeks. And what I will tell you is exactly what I have said to many people throughout our state and throughout our country with respect to that. And that is, when you look at the stated goal by our federal partners, I would argue that when you have a state like Mississippi, a state which has tested significantly, a state which has done, I would argue, very good work in slowing the spread of the virus, a state that, quite frankly, has never, to this point, had a major peak. We've actually had a plateau of cases, and if you look at a 3 to 5 day moving average of total number of cases, while we've had a very slowly upward sloping curve, it's been much more of a plateau than it has been a peak. Compare our chart over the last 60 days to the chart in New York City. If you only looked at those guidelines, which said 14 days of declining case numbers, and thought that was the only thing that mattered, then what you would say is New York has had many more than 14 consecutive days of declining cases, but New York also had, over the weekend, more deaths over the weekend than we've had throughout the entire series of this particular crisis. And so the fact is, when you look at a state like ours that has been successful at slowing the spread, at flattening the curve, at creating a plateau rather than a peak, then in my opinion, those standards really do not apply to states like Mississippi. I had that conversation with Dr. Birx. I've had that conversation with many of our federal officials, and I would simply say that there is general understanding that different states are in different phases and have to adjust, and that is the exact reason why the White House put out guidelines but left it to the governors to make the decision on what was best for their state, because we have a better understanding of what's happening in our own state. Similarly, we as governors don't have to have a statewide strategy or a statewide plan that doesn't take into account some of the things that are happening in individual counties. It's the very reason why we were opening up our state today to more small businesses, while at the same time telling you that we are in conversations about putting further restrictions in the 5 or 6 counties where the number of cases are growing the fastest in small counties. And so it's the same concept. We have to make our decisions based upon advice from our public health experts, based upon the data, and based upon what's best for Mississippi.
And if you look at the different metrics that you're supposed to use, the case count's one of them, but there's 2 more, right? There's the influenza-like illness, but also the COVID-like illness declining, and it's been declining steadily, and that's on our website too, for weeks. And so that one's been dropping, and also too, healthcare resources being available in sort of standard of care ways. And certainly we feel that, we're there and talking to our hospital systems and healthcare providers that they are more than capable of taking care of folks with normal standard of care.
The point being, it was never our intent to, although we would have loved to have been able to, I don't believe it was a realistic goal to say we're not going to have any COVID-19 cases in Mississippi. Our goal from the outset, for weeks and weeks and weeks on end, has always been the same. That goal is that if you are sick with COVID-19 and you can get better with quality health care, that you get that high quality health care. It is about protecting our healthcare system to ensure that everyone who can get better with quality care gets that quality care. Our total number of hospitalizations, our total number of ICU beds currently in use, our total number of ventilators that are currently in use are at a level that we feel confident that we can continue to maintain that posture, that goal, and be successful meeting it.
Anita from Sun Herald has another question. Anita?
Hey, Governor Reeves, I have a couple of questions for you. First of all, I'm wondering if you can please specify as much as possible so that we can be clear with our readers about who exactly would lose or will lose unemployment benefits if they don't go back to work, because I heard you say you could lose them, but we have unemployment attorneys for businesses wondering who would lose their benefits if they don't go back to work. And also I'm wondering, because we don't get to see you down here on the coast, if you are wearing a mask out in public. You've urged people to wear masks. Most people I see are not wearing them. I wonder if you wear a mask, and if so, when and why.
Well, thank you for those questions. The way I would answer it is as follows. The first question: the fact is that we have relaxed our requirements for state unemployment benefits, but the Department of Labor has stated that states cannot categorically waive able and available work requirements. We have more flexibility with work search requirements. Therefore, the provision in the order that I signed today states that the able to work, available to work, and actively seeking work requirements found in Mississippi's law shall be reasonably interpreted for claims filed from the beginning of this on March the 8th until June 27th of 2020, where individuals are unable to search for work because of COVID-19. And there is a team of people at the Department of Employment Security that will make these determinations on an individual by individual basis. What I am imploring my fellow Mississippians to do is that if you are well and you do not fit into one of those vulnerable categories, and you can go back to work and your job has been offered to you, I strongly encourage you to go back to work. Again, what is the law as it relates to that? Well, that's a decision for employment security and that individual to make. But if it's close, I encourage you to go back to work, because I think that makes the most sense for all Mississippians. And I will tell you, Anita, that while you don't get to see me down on the coast, it's not by my choice. It's because we've been kind of busy up here trying to manage this public health crisis, and I cannot wait. I assure you, I cannot wait to get back down to the Mississippi Gulf Coast. Any region of our state where I can get 75 or 80% of the vote, I want to get down there as often as I possibly can. Got a lot of friends down there, and I miss every single one of them. So I hope you tell your readers that I can't wait to get down there and walk on the beach with you, but we got to get through this crisis first. With respect to mask, I am spending very little time in public right now. I'm spending pretty much 24 hours a day, 7 days a week on one square block in downtown Jackson, because that's where our headquarters are for running this response to the virus. And so I do have a mask. We had some fantastic masks that were delivered to us anonymously that really look good. They actually have a thing of a copy of the state of Mississippi. I think it says Mississippi Strong on it, and I have worn it several times. My wife Ely, when she goes out to the grocery store, which is rare, but when she goes out to the grocery store or goes somewhere in public, she is wearing a mask, and I encourage every single one of you to wear a mask when you're in public. Now, to be fair, because I want to be honest with everyone, on Saturday mornings when I get out and run by myself around the Capitol and there's no one within 6 miles of me, much less 6 feet, I am not going to be wearing a mask. And so anyone can write that story that governor's out in public and not wearing a mask. But again, it's about risk factors, and it's about making sure that people will understand that they're trying to take care of themselves, but also not only take care of yourself, but take care of your friends and take care of your family members. Any other questions? Seeing none, thank you, Mississippi, and God bless.